Hi there. My name is Joyce Grace Garnica. I am currently an active student at Gonzaga University, concentrating on my Doctor of Nursing Practice degree. I've been a nurse for a little more than 9 years now, and I spent most of my career as a member of the United States Army Nurse Corps. In all these years, I've had the privilege to working in the military and their families, both active duty and veterans. Being an officer in the United States Army, I've had chances to work in different areas of nursing specialty as well as an investigative officer, which prompted me to initiate a program after witnessing how much our service members suffered from post traumatic stress disorder or PTSD and in need of tremendous help as they experience obstacles to receive the care they need. This is one of the primary motivations for initiating a social institution because of the myriad of veterans who had died or committed murder from medical and mental problems while waiting for the treatment. PTSD is a mental health problem that some people develop after experiencing or witnessing a life threatening event such as combat. Today, I would like to introduce to you the exercise to recovery from post traumatic stress disorder or ERPTSD social institution. Why is it a big deal? When the war comes home with a soldier, 1 in 5 veterans of the wars has been diagnosed with PTSD. That's nearly 300,000 veterans. With the veteran population continues to grow, the problems and number of suicide deaths and deaths of innocent human beings also increased. Recently, it was reported that nearly 1 in 5 suicides nationally is a veteran, in which 49,000 took their lives between 2005 and 2011, an increased average of 2.6% annually. In 2013, the VA reported that 22 veterans committed suicide per day, or one every 65 minutes. Annually across the nation, the health care for a veteran with PTSD costs 3.5 times as much as care for those without the disorder. That costs about 8,300 per veteran treatment in the first year, which is significant to consider in the federal budget. It has the most dollars spent among healthcare issues, with the presidential budget of 56 million in 2016. Looking at the epidemiological data on PTSD care among veterans, the need is great, but the care gap is lacking. With more and more military troops returning home without adequate support services, numerous are struggling to readjust to civilian life after multiple tours, spending longer times in the combat zone. It is up to them to seek the help they need, and often this help is not easy to find or to access. They are in agony of anticipating when to get treated with conventional treatments or to receive the health care they deserve. With this desperation, veterans become easily influenced by anybody and any methods they believe could assist them to ease the debilitating condition they suffer. Perhaps even influenced by culture or advertisements that drawn them to purchase and gain a desire to have an increased sense of control with their treatment that could be fatal and dangerous to their health. Being a military myself and a provider, I felt the urge to do something to help out my fellow service members. The motto I wanted to impart to this population is to develop a balance of 3 paradigms: raise consciousness, create experiences, and free the soul. Then the idea came up to start a social institution to serve and teach the moral integrity, personal discipline, courage, and humility, a sense of purpose and responsibility, and the commitment to the lives of those who suffered PTSD among military veterans. Its purpose is to expand care for veterans, bolstering the resilience and acceptance through social interaction with fellow service members while participating in the camp therapy for PTSD. The mission and vision of this social institution is to rebuild the spiritual life of the military veterans by exploring the idea and effects of PTSD on themselves, their families, and communities through yoga and meditation training and exercises to help them heal, recover, and restore moral conscience and self esteem while transitioning into civilian life. Its core values are passionate service, performance, accountability and empowerment, dedication and commitment, and education. The Healthy Living states that camp therapies such as yoga and meditation training could help people to ease the symptoms of PTSD. The institution that I am initiating, the ERPTSD, will be integrating yoga and meditation program as preventative intervention in conjunction to the conventional PTSD treatment. These yoga and meditation therapies are considered simple and inexpensive interventions which are valuable adjunctive therapies. This institution is more geared to cost reduction versus profit generation, and the idea is really to decrease the PTSD symptoms, decrease the death rates of both military and affected civilians, thus decrease the healthcare cost, the hospital system cost, the insurance company's cost, the taxpayer's cost, as well as the individual and every employer's cost. Because this institution is not mainly focused on the profit, we are looking forward until low operating budget. Its revenue streams include but not limited to the VA funding, grants, public or private donations, reallocation of resources from the Department of the VA, inside sale of training materials, foods, snacks, non-alcoholic beverages, and the nutritional supplements approved by FDA and the military. With these revenue streams, we can accommodate the fixed cost, which is the building and space rentals if there's no room available at the VA healthcare centers, and the variable costs, which are the payments for consumed utilities, minimal need of office supplies, educational materials to be used in the training, but the goods and merchandise will be dependent on public-private donations. Our key partners and customer segments who can help leverage this institution will be the VA's mental health departments and clinics, the veterans and their families from all branches of the military who suffers PTSD, primary care providers, camp therapists and interns, yoga students and instructors, camp researchers, support groups, volunteers, family, as well as the community. It is primarily focused